Today we're talking about esophageal cancer. That's right. I'm going to tell you what it is. By the way, it's cancer of the esophagus. I'm going to tell you what the risk factors are, the symptoms as well, and some prevention measures. I do think this is really important to talk about because this particular cancer has a lot of sort of specifics, many of which in terms of risk factors we can do something about. So guys, first of all, I do want to tell you where the esophagus is. By the way, the esophagus, in case you're wondering, is a hollow muscular tube that connects our mouth with our stomach. It's the tube that really delivers food and drink from our mouth down to our stomach. That's what we're talking about today. Oh, and by the way, I'm Dr. Jen Caudle, practicing family physician, on-air health expert, and video creator. Guys, if you've not subscribed to my channel or clicked the little bell for updates, I invite you to do so. I do videos like this all the time. All right, so that's what we're talking about, is this hollow tube, okay? Now, the thing about it is this tube, just in most adults, which I think is interesting, is about 10 to 13 inches long. It's hollow and muscular, as I mentioned, and where it sits just in the body is it sits right behind the windpipe or the trachea and right in front of the spine, okay? Now, like many parts of our body, we can get cancer here just like we can get cancer in other places. There are two types of cancer, squamous cell and adenocarcinoma. I'm not going to focus so much on the types, but I did want to mention that, okay? So let's start by talking about risk factors, okay? Who's most likely to get esophageal cancer, or this cancer of the pipe, the hollow tube that carries food and drink to our stomach? Well, first of all, the older we are, the higher the risk. So generally in people over 50, it occurs in, and then as our age goes up, the risk goes up as well. Also, this cancer is more common in men than women. And interestingly enough, there's a higher prevalence in Asia, South Africa, Eastern Africa, and Northern France, okay? You know, this is the thing. There are a number of risk factors. I'm gonna tell you what that is, but let me start by talking about the symptoms. I think that's really important because with esophageal cancer, one of the tricky things about it is you may not even know you have it in the beginning because oftentimes people are asymptomatic or they don't have any symptoms. When we do get symptoms is often when we start looking and saying, okay, what's going on? But as you all probably know, finding cancer early is always the name of the game, which is sometimes what makes this cancer tough. But symptoms that people can have when they do develop symptoms is they can get what's called dysphagia, or trouble or difficulty swallowing. And generally with this cancer, it gets worse. So you may find that instead of eating solids, somebody will start incorporating more liquids or soft foods in their diet. They may not even realize why they're doing it, okay? But that may be something that they do to deal with the fact that they have trouble swallowing. Also, unintended weight loss, losing weight without trying. Also, persistent heartburn that doesn't respond to treatments, okay? Getting that sort of burning. Some less common but still very, very important symptoms are things like hoarseness. Okay, some people will get a hoarse throat. Other people may get a cough as well, and some what we call warning symptoms, symptoms that are always like alarm symptoms that we would always worry about is sometimes people get painful swallowing, that's adynophagia. Sometimes people will develop an anemia, symptoms of anemia. Now, by the way, anemia often occurs in many different types of cancers. It also is a symptom or can be a symptom of esophageal cancer as well. People may get bleeding or obstruction, right? They may get a problem with the tube where it kinks up and things can't pass. It's obstructed. We talked about weight loss before, but certainly greater than 10% of losing your body weight in 6 months or less is warning sign, is worrisome. And then chest pains as well, because remember, this is a tube that goes from our mouth down to the stomach, and it may actually feel like you have chest pains because of where the tube, the esophagus actually lies. So those are some symptoms, but keeping in mind that people don't always have symptoms in the beginning. Now, I do want to mention the risk factors because I know you're saying, well, what can I do? Well, who gets it? All this kind of stuff. And we talked a little bit about men, people over 50, etc. But the risk factors are tobacco use, okay? Tobacco use really of any kind. So this is definitely a wake-up call to assess if you use tobacco and to really think about quitting, to quit, okay? Also, excess alcohol, a huge risk factor here. Obesity, also a history of gastroesophageal reflux disease and or Barrett's esophagus, which is a condition caused by prolonged or gastroesophageal reflux disease that goes on for a long time that ends up changing the cells of the esophagus, turning it into a Barrett's esophagus, okay? A lot of complicated words, but I think the most important thing for you to understand is heartburn, smoking, drinking, obesity. Those are things that are risk factors if you want to sort of boil it down to a nutshell, okay? And then understanding that many people with esophageal cancer, as the cancer goes on, as things progress, the symptoms get worse, all right? So let's now talk about things that we can do. because that's always important to talk about here. And things that we can do are, first of all, we talked about smoking or tobacco. Cut out the tobacco. If you don't if you don't smoke or use tobacco, please don't start. And if you do, this is the time to quit, okay? Limit your alcohol, only alcohol in moderation. Avoid obesity, making sure you're eating plenty of fruits and veggies. And also get treated for your gastroesophageal reflux disease, or, a symptom of that can be heartburn. Make sure you're getting treated for that. Also being assessed for Barrett's esophagus if you have gastroesophageal reflux disease. So guys, I hope this is helpful. Many of you have asked me to talk a little bit about more about esophageal cancer. Those are some nuts and bolts, okay? Again, it's not something we hear a lot about, but I do think it's important. Guys, I'm Dr. Jen Caudle. If you've not subscribed to my channel and click the little bell for updates, I invite you to do so. I do videos like this all the time. Also consider joining my subscription groups. Guys, I'll be back soon.